Here I'm going to talk about the EKG, what necessary need for NCLEX board exam. I'm just going to focus on them. What is EKG? It is electrocardiography. It is the process to producing an electrocardiogram, right? It is the graphical representation of different heart events. So this is the graphical representation. So this graph of voltage, right, versus time of electrical activities of the heart when we using electrode placed over the skin area. Like this picture, we can see this one, we put the electrode over the heart, and this electrode can represent, look like this. We call it graphical representation of cardiac events, right? And here in this picture, we see this one is called AC node. It is AV node. So AC node can produce the impulses because heart is a specialized tissue or organ. They can produce the impulses. It is electricity. It is the electricity. So in this picture, we can see the normal events or wave of EKG. A normal EKG contained waves, contain intervals, contains segment, and also one complex we call QRS complex. So the waves, the P wave, Q wave, T wave, so positive and negative deflection from the baseline. So if the red line here, it is called baseline. In the relationship on this baseline, like the P wave, it is positive deflection from the baseline, right? And that indicate a specific electrical events. The wave on an EKG include P wave, include Q wave, include R wave, S wave, T wave, and U wave, right? See the normal EKG. So in this picture, we can see P wave positive deflection, R wave positive deflection, T wave positive deflection, but Q wave, S wave is a negative deflection. It is normal. If you really want to know abnormal, first of all, you have to know what is abnormal. No, you'd have to know what is normal to understand what is abnormal. Okay, so right now in this picture, positive deflection P, and this is a complex we call QRS complex. So in this picture, we see the P wave here. Why P wave produced? P wave is produced because atrial depolarization. QRS complex produced because of ventricular depolarization. T wave produce ventricular depolarization, repolarization. Depolarization means active phase, action potential, but repolarization means resting phase. When heart in the resting phase, that times this wave can produce, right? So what NCLEX board sometimes asks, what are the what wave when produced, right? So here, let me show you this one, P wave, positive deflection can produce because of activation of atria. This is the atria, right? Because of activation of atria, P wave is produced. And this is the QRS complex produced because activation of ventricle. This is the ventricle. What are the activation? I'm not going to explain action potential, what is depolarization, repolarization right now. Make it easy. Contraction of the ventricles, right? Complex. And T wave, positive deflection, produce recovery phase. Recovery phase. Or you can say this is the produce because of repolarization, right? Ventricle repolarization. And QRS complex, ventricular depolarization. P wave, atrial depolarization. Simply, NCLEX would ask the question, when P wave produce, when QRS complex produce, we must know, right? So here, let me recap it few more. Different waves showing the picture. P wave represent or activation of the atria, complex activation of ventricle or ventricular depolarization, and T wave represent the recovery phase or ventricular repolarization, right? Here, a little bit explain what is depolarization and repolarization, and what are the RMP, right? Membrane potential, how they work up to the certain level, they come back, we call resting phase. Now here, few questions about NCLEX board exam. This is my target today. So what are the different questions come and what we need to know for board exam? Here I'm going to explain few pictures that I collected for you, my friend, because this is important for NCLEX board. If we know them, it is more than enough to answer the board question. Now let me explain one by one. So first one, in this picture, we can see this is P wave complex, QRS complex, and T wave. This is the normal EKG. Same events here, and here too. So this event said it is a normal sinus rhythm. So normal rhythm or normal sinus rhythm. Why we call sinus rhythm? Because you can see this is SA node. It is the special tissue inside the heart. They can produce the impulses. So EKG start. This SA node produce impulse and they transmit from SA node to AV node. From AV node, they go through the band of His and finally Purkinje fiber and distributed all over the ventricles, and our tissue get activated. So this is the reason we say heart is a specialized tissue. So if SA node or impulse does not produce from SA node, does not produce either even AV node, we say abnormalities, right? SA node can produce impulse 60 to 100 beat per minute. If the range is not in between the normal, we also say abnormal. So first of all, there are two abnormalities. If SA node does not produce the impulse, if impulse produced anywhere except SA node, we call abnormalities. SA node supposed to produce the impulse 60 to 100 beat per minute. If they does not produce in between this range, we call abnormalities, right? So again, my friend, when SA node or normal sinus rhythm produce 6 to 100 beat per minute, it is normal heartbeat, and the normal heartbeat ranges. When less than 60, we call bradycardia. When more than 100 beat per minute, we call tachycardia, right? Or we call atrial flutter or atrial fibrillation. So normal rhythm, when within this range, it is called rhythm is normal, right? But if the interval, like this is the 1p, another p is here, another p is here. If it is interval is every time constant, we call regular rhythm. So normal means events must contain positive p wave, must complex positive QRS complex, must contain positive T wave, right? So normal means there is a P wave after every QRS complex. So like this is a complex. Other events, the P wave is absent. Other events, P wave is absent. It is abnormal. Let me recap it. I said normal means there are P wave after every QRS complex. This is the normal. Keep in mind, NCLEX may give you a question with rhythm. So when you get the strip, just give a look, just like this picture, you can see, give a look, it is called strip. You must be able to identify what they are and what are the treatment as well. But very few, again, come in the board. So now some feature here about the EKG, normal EKG. Normal EKG, the normal rate, what are the rate? Everybody knows 60 to 100 beat per minute. So what should be the rhythm? In case of normal EKG, it should be regular, right? Means P, one P to another P, interval should be equal, constant. So in a second, I said, is there any P wave before each QRS complex? Yes, right? This is the QRS complex here. Before QRS complex P wave. Here the QRS complex, another P wave. QRS complex, another P wave. QRS complex, another P wave. So same event, repeat, and so on and so forth. So it is normal, basically. Again, in case of the normal, number 4 question, I said, are the P wave upright or similar? Answer is yes. Every event, the P wave is similar, right? Look like normal. And what are the length of PR interval? PR interval should be 0.1 to 2.0 second. What else? The QRS complex interval or length, it should be 0.06 to 0.12 second. So sometimes NCLEX would ask the PR interval. So this is the P wave and this is the R wave. So PR, again P and R, PR. So the PR interval always supposed to be 0.12 to 0.20, the normal second. NCLEX would simply ask, what are the length of QRS complex? The normal range, 0.06 to 0.12 a second, right? So in case of the normal sinus rhythm, we do not need any treatment, right? We do not give any medication them. So some question here I said, if we do not get any abnormalities, we do not need treatment for normal sinus rhythm pattern, right? And in the documentation, when we write, we should write the EKG findings is normal, right? So next picture here, this one here you can see, it is called atrial fibrillation, right? Atrial fibrillation. So the atrial fibrillation. So normally every student know the heart rate is 60 to 100 beat. But if the heart rate is more than 150 or more than 300, that times we can say atrial fibrillation or atrial flutter. So when the fibrillation or abnormal beat produced from atria, we call atrial flutter or atrial fibrillation. When abnormal sinus produced from ventricle, we call ventricular flutter and ventricular fibrillation. So because of the origin of impulses, we called atrial. If impulse produced from the ventricle, we call ventricular. Like supraventricular tachycardia, the simple word we use, right? It is, I said, supraventricular tachycardia. What is tachycardia? Means more than normal heartbeat. Means heartbeat more than 100 per minute. We call tachycardia. When tachycardia produced from the atrium, we call atrial. Atrial flutter, atrial fibrillation depends upon the number of beat. But my friend, this is the atria. This is atria, left and right. And this is the atrioventricular separation. This is ventricle, this is ventricle. Atria is superior to the ventricle. And I said tachycardia produced from atria. It is superior to the ventricle, so it's called supraventricular tachycardia. Abnormal impulse produced from atria that is superior to the ventricle. So SVT or supraventricular tachycardia means it is abnormal beat produced from atria. It is easy way to explain. Now let me go back again here. So in this picture here showing atrial fluttering. In case of atrial flutter, what are the abnormality or what are the beat we can see? You see, this is complex, QRS complex. Normal picture you see complex. And as I told you, after normal means there are P wave after every QRS complex. But this is Q waves, another Q wave, another complex, but It's supposed to be one P wave, but you see, this is a two P wave. This is the other complex, but two P waves. But here, normal picture, we supposed to be get one P wave before to start another QRS complex. So this is extra P wave. It is look like saw, look like the saw. I said, right? We call saw-teeth pattern. So when there are two complex, but in between two complex, there are so many P wave and look like the saw pattern, it is atrial flutter. So the atrial fluttering, I said, also it is important to know that atrial rate or atria is represented by the P wave. Remember at the beginning I said, this is the P wave, and P wave, why P wave is produced? Because of atrial contraction. P wave represent by the, atrial contraction or atrial rate is represented by the P wave, and ventricular rate is represented by QRS complex. So when we see so many P wave, means something abnormal in atria, right? So in case of atrial flutter, here I said two P wave side by side, and there are two P wave after every QRS complex is the typical findings of atrial flutter, and they are look like saw-teeth pattern. So the saw-teeth pattern look like it is distinguished atrial flutter. So I think I can see the heartbeat look like saw when we called heart flutter. My heart is flutters. So now a few questions here about atrial fluttering. So at least we know atrial flutter is abnormal. It is not normal, right? So what is the rate we can see? Usually in case of fluttering, we can see the heart rate more than 250 to 400 beat. So when heartbeat more than 100, tachycardia. If tachycardia produced from atria, we call atrial tachycardia, more than 100. But more than 100 means how much 100? More than 100. More than 100, 500, 600, 700. We need to figure it out. So if it is more than means more than 250 or 400 in between heartbeat, it is called flutter, right? So keep in mind, if I ask you what are the rate, atrial rate is the faster, right? And faster than ventricular rate. In case of the ventricular rate, it should be variable. Atrial rate, same time, or we can say the double than the ventricular rate. If I said what are the rhythm in here, atrial regular or ventricular irregular rhythm would be. If in this picture, is there any P wave before QRS complex? But it is two P waves. So normal P wave are absent, right? Because it's abnormal two P waves. So you see the P wave, is the P wave upright or down deflection? It is similar. So definitely this is the upright P wave, look like a saw-teeth pattern. And what are the length of PR interval. So in this picture, the R wave is not clear, but here the R wave is there. It is very clear. It is very clear. So don't miss with the normal and abnormal. These are one complete events. P complex T wave. P complex T wave. So it is the P, it is the T, not two P together. Like here, it is both are P wave, not the T wave, right? So in case of atrial flutter, the length of PR intervals is not measurable. And in case of what are the length of QRS complex, it is normal because there are no problem in my ventricle. Ventricle normal range is 0.06 to 1.2 second, and these are normal, right? So NCLEX would if asks why patient have atrial flutter, answer is maybe the valvular disorder, mitral valve problem. Maybe patient has a ischemia, or patient has a cardiomyopathy, right? Or sometimes patient has a COPD, congestive pulmonary obstructive pulmonary disease, and heart is affected, or if patient has a emphysema, right? So how we treat atrial flutter, or even how we treat or treatment is atrial fibrillation. In both cases, we give them cardioversion, right? So if NCLEX board asks, what are the nursing intervention for atrial flutter? We give them cardioversion, the treatment of choice. NCLEX board frequently asks this question. So also keep in mind, if patient have atrial flutter or atrial fibrillation, they have a tendency to formation atrial blood clot. Very important for board exam. And if patient have a chance to atrial flutter or blood clot, we give them anticoagulant. It is called heparin, and heparin prevent the blood clot formation. Keep in mind that cardioversion is the treatment of choice for atrial fibrillation. Again, let me recap it. Patient with atrial flutter or patient with atrial fibrillation, they have a chance to develop blood clot. So we give them heparin to prevent the clot. What is next? Next is here, this picture you see, how look like it is. The NCLEX board, I say this is the sawtooth pattern, and this is the very QRS complex is very wide. So if I go back the normal picture, this is QRS complex, QR, and this is not that much wide, look like this. And there are nothing other waves. Only complex, right? So it is called ventricular tachycardia. So abnormal heartbeat, and this beat produced from the ventricle of heart, we call ventricular tachycardia. So the here is, it is easy to see in electrocardiography or EKG representation, we can see very wide QRS complex is very wide, right? And this picture, like this one, this strip is actually monomorphic pattern, and it is VTAC or ventricular tachycardia. In case of ventricular tachycardia, NCLEX board asks this question, never we should pick epinephrine for BTEC, because epinephrine starting ventricle increase the rhythm more. So already your patient have a tachycardia. If you give them epinephrine, tachycardia is be more worse or will be dangerous. That is danger for VTEC patient or ventricular tachycardia patient, right? Keep in mind, ventricular tachycardia is really super easy because all QRS complex in the strip, there are no other webs, right? So few question like before, what is the rate here in case of ventricular tachycardia? In case of tachycardia, ventricular tachycardia, usually the rate is 100 to 200 beat per minute. And what are the rhythm? Rhythm is regular because the space in between two complexes is normal, well. And is there any P wave in this strip? There are no P wave, no T wave, right? And no U wave, only complex is there. So there are no P wave. P wave is absent. After the P wave, upright or similar is absent. So we can say anything. Every ventricular tachycardia, no P wave, right? And what are the length of PR intervals? It is no P wave is there. So how we measure it? Not measurable. And what are the length of QRS complex? Usually it is wide greater than normal, and normal is 0.10, right? So if like ask the first if it is stable or unstable. So if the patient strip look like this, is it stable or unstable? Ventricular tachycardia. Keep in mind, before starting any medication, we ask the patient if the patient we find it out patient is stable or unstable. Then we start the medication. It is important. Stable patient, what does it mean, stable or unstable? Stable patient means the patient blood pressure is normal, right? So if the blood pressure is not normal or vital sign is not normal, we said unstable patient. So if the blood pressure is normal, but patient has an abnormal ventricular tachycardia or electrical representation showing VTEC look like this, very wide QRS complex, we start the treatment. So when we start the treatment, make sure your patient is stable or unstable. How you make sure? Check the vital sign, check the vital blood pressure. So if vital sign or blood pressure is normal, it is stable. If it is not normal, it is unstable, right? So usually when we start the medication, we give them like defibrillation. Treatment is defibrillation. Keep in mind, what are the treatment of atrial flutter? Few minutes ago, I said cardioversion, and here is defibrillation. And we do CPR until defibrillation mechanism arrived. So like you are walking in the floor, suddenly a patient have ventricular tachycardia. So you tell your co-worker to bring the defibrillation machine. Before to bring it, we do CPR until defibrillation machine will be there. So keep in mind, let me recap it, redo this. We never ever pick epinephrine as a treatment for ventricular tachycardia because it stimulates the ventricle, right? So sometimes NCLEX board asks, in case of ventricular tachycardia, when we could start CPR. We start CPR if patient has no pulse rate. Again, I want to recap it. Before start any treatment, we ask first the patient is stable or not stable. Keep in mind, if there is no tissue perfusion or blood pressure, abnormal pulse rate, it indicates patient is unstable. And in what medical condition patient can have the ventricular tachycardia? If they have cocaine abuser, chest trauma, digoxin overdoses, right? Or hypokalemia or low serum potassium, patient have a chance to develop ventricular tachycardia. And next picture here, it is not that much good looking in this graph. In the top one, it is called asystole. So in this picture, you can see there are no wave at all. So here we do not see any wave at all. It is look like a flat, nothing, no wave here, right? If it is no wave, means death, life is gone over, passed away, and it is called asystole. Asystole means no electrical activities, no pulse rate, no blood pressure. So if there is a straight line, it is called asystole. So if patient have a asystole, suddenly we can get before die. What we could do, we give them medication. Two medication we could try. First, give epinephrine, and second, atropine. So epinephrine and atropine, in that case, life-saving medication, right? So if the monitor say, the monitor, EKG monitor in the hospital, if monitor say asystole, but if the patient is clearly active, then we have to recheck it first. And we have to check the lead placement. What is lead placement? Look like this. This is the lead. We have to check this, they are okay or not okay here. And now let me see another one. In this second picture here, you can see here, this is, let me show, this is normal events, P, QRS complex and T-wave. This is normal, this is normal, this one is normal, this is normal, but unfortunately, something is abnormal in between normal, right? And this is called premature ventricular contraction. Is shortly called PVC. So all is normal, but suddenly one is abnormal. This is premature ventricular contraction. PVC are essentially normal, basically, and this is the sinus rhythm with a single or recurrent wide QRS complex. Look like this. This is QRS complex is very wide, but rest of them is abnormal. Might be the single, might be multiple or recurrent. And this is called premature ventricular contraction. So in that strip, you can see all is normal, but 1 and 2 is abnormal. It is PVC. What are the treatment? Treatment is we can give them lidocaine, right? So PVC can happen in normal people as well, right? Also be concerned if there were more than 6 in one row or one EKG, more than 6, or more than 6 in 1 minute. This is abnormal, right? Now, 2 questions here, shortly explain. One question, let me read it here. A client is having frequent premature ventricular contraction. A nurse would place priority on assessment of which of the following items. So like you are working in med-surg in or ICU, suddenly you see a EKG and premature ventricular contraction. What is the priorities? 4 options. 1, we could check the blood pressure and peripheral perfusion. Number 2, sensation of palpation. Number 3, causative factors such as caffeine. Number 4, precipitating factors such as infection. Number 3 and 4 is important, but what is the priority? We have to follow the nursing process, right? First of all, we do the check the vital sign. Why vital sign? I have to know my patient is stable or unstable. If they are stable, I can go for the next steps. What is next steps? If patient vital sign is normal, suddenly we can get one QRS complex of premature ventricular contraction. We never do anything, no treatment necessary. But if we see the vital sign is abnormal, we have to talk to the healthcare provider, right? So number 3 and 4, this is the cause of PVC. So what are the cause of PVC or premature ventricular contraction? Maybe infection, maybe caffeine or nicotine abuse, or also alcohol abuse can cause this. So here I said next here. In this picture, everything a short review. Let me show you, and you can see the few picture as well. And same what we discussed before. And here I can just review them in a short. Okay, so there are some strip we can see. The first one is sinus bradycardia. How we say it is sinus bradycardia? The events is normal. P, Q, P, QRS complex and TOF. All is normal. But still how we can see? We can see or we can find out the heart rate. How we can find out the heart rate? We can divide it 300s. We can, let me write it. So how we can find out the rhythm? That always 300 is constant. We divided 300 by number of the boxes. Number of the box. In this picture, it is 3.5 box. And it should be equal like 35 beat per minute. So 300 is a constant. How we get 3.5? How we get it? The way to get it, let me show you. Let me show you. So now here, this is the complex and other complexes here, right? in between two QRS complex, how many boxes here? You have to count down. 1, 2, 3, 4, 5, 6, 7. How many? So 30 bigger box equal to 6 seconds. It is, you have to remember, right? You have to remember, I said. So total big box, we don't count the small one. Big box we count, okay? How many boxes in between? So total box number divided by 300, we can get the rate. Keep in mind, this rules only for regular intervals EKG strip. If the irregular intervals, the different way to count, right? So I said this is sinus bradycardia because the heart rate is less than 50 here, less than 60, or it is here is 35, right? If patient have a sinus bradycardia, what are the treatment option? We give them atropine, right? Okay, or patient need to pacemaker. And this picture is sinus tachycardia. So abnormal heartbeat produced from SA node or atria. So it is called sinus tachycardia. So how we know this is the abnormal heartbeat? Again, same formula. This is the complex, another complex. QRS, another complex. So how many box in between two complex? This is the one box and this is the two boxes, right? Let me write it here. As I told you, this is the P wave here, another P wave here. This is the P wave. So in between two P wave, how many boxes in between? This is the one box here, one box here. This is any one. If you go this one, P and P, one box, two box, one box, two boxes, one box, two boxes, one box, two boxes. So it is regular. When it is regular, we 300 divided by total boxes in between two QRS complex. In between two complex, two boxes, two. 300 divided by 2, it is 100, 50, right? 150 is more than 100 and is a tachycardia. It is tachycardia. So my patient have a sinus tachycardia. So these 300 rules only applicable if the interval is regular. How you know interval is regular? Count down the how many boxes. If it is constant, 300 formula. If it's not constant, we go different formula, 6-second formula. So it is sinus tachycardia. So if our patient have a sinus tachycardia, what are the treatment option? Treatment, we better to go treat the underlying causes, right? So underlying cause we have to find out, and we have to monitor the patient if patient have a sinus tachycardia. Another picture here, atrial fibrillation. Few minutes ago, I already explained atrial fibrillation, right? So it is called rhythm is regular or irregular, or P wave is absent, right? And this atrial fibrillation, patient have a chance to develop the blood clot, right? So again, I said in case of atrial fibrillation, here you see atrial fibrillation here. we see the how you define atrial flutter. Atrial flutter is a sawtooth pattern, right? And atrial rate should be 250 to 400. But atrial fibrillation, not flutter, heart rate is 400. You see, 400 to 650, 600. So if heart rate more than 100, tachycardia. If heart rate is 250 to 400, it is atrial flutter. If heart rate is 400 to 600, atrial fibrillation, right? How we go to find out the heart rate? We have to follow here the not 300 formula, because the interval is not equal. It is irregular intervals. We have to go 6-second formula. So if your patient has the atrial fibrillation, what are the treatment options? We give them digoxin or atrial or cardioversion, or sometimes we give them anticoagulant like Coumadin, because patients have a chance to blood clot formation. And this picture or events, sometimes it is called chaotic firing, right? And also very narrow QRS complex, but here very wide QRS complex. Ventricular tachycardia, very wide complex, but here is very narrow. And this pattern is called chaotic firing. It is the very characteristics. But NCLEX board asks, if patient has atrial fibrillation, we need to prevent the blood clot. Give them Coumadin or warfarin. This one, ventricular fibrillation. So in case of ventricular fibrillation, you see here, ventricular fibrillation, what we can see. Ventricular fibrillation, also we can see the result of the absence. I'm talking about this picture, this one. Ventricular fibrillation. It is not sawtooth pattern, and this is chaotic firing. So ventricular fibrillation result in absence the cardiac output or absence the P wave, QRS complex not apparent as well. Definitely it is not normal. If the patient has a ventricular fibrillation, we give them anti-dysrhythmic medication like amiodarone or defibrillation, right? Next one is ventricular tachycardia. In case of ventricular tachycardia, QRS complex is very wide. It is called monomorphic VTEC pattern, right? Monomorphic, wide complex. So if you count down by 6-second formula, we can see the heart rate 100 to 200 beat, and they produce from ventricle. It is called ventricular tachycardia. If patient has a ventricular tachycardia, treatment is defibrillation. So before arriving the defibrillation machine, we can do the CPR, right? Again, I want to recap it. In case of patient ventricular tachycardia or ventricular defibrillation, we never give epinephrine, right? Because epinephrine is a stimulant of the ventricle. And last picture here, it is called asystole or asystole. Asystole means no electrical activity, no pulse rate, no blood pressure. If patient has a asystole, a straight line look like this, we give them oxygen, intubation, and external bracing. two medication are allowed, epinephrine first, then atropine. We have to monitor. If the EKG monitor say patient has asystole, but patient is still alive, we can check for lead placement. Maybe there's something abnormal about the leads.